tuned in to News and Views with myself, Salailo Makwidiri. The time is 20 minutes past 9, and right now we're going to be turning our attention to I think, a mounting concerning turn of events in KZN, and I think all over the country, to be honest, where dozens of newly qualified medical doctors remain jobless. This is despite the province's desperate need for healthcare workers. Some of these doctors have carried out sit-ins and marches, and most recently setting up makeshift clinics outside the Premier's office in Pietermaritzburg. This after repeated promises to advertise just 20 posts. That's also nowhere near enough to cover the demand and the gap that the healthcare system has for doctors. There's knowledge that the province faces, hundreds of vacant doctor posts, but yet still no action from government has been made. Meanwhile, these trained professionals, armed with community's trust and clinical skills, are left in limbo. To help us understand the depth of this crisis and the urgent fix that is needed, I'm now joined by Dr. Zanele Bikitsha. She's the Vice President of the South African Medical Association. Dr. Bikitsha, thank you so much for making time on News and Views. I really appreciate you joining us this morning.
It's a pleasure. Thank you for the invite to discuss this matter.
No, definitely. And I think it's very, very important because I think if you had asked me when I was still in school that there would come a point where you would have unemployed doctors protesting outside government offices anywhere in the country, I would brush it off. I would slap you for lying. But this is where we find ourselves at this moment. How and where did we get it wrong?
You'd have to go back. To start with, you've got a department that is running itself but does not have staffing norms. They have not adopted international staffing norms, which speak to how many clinicians do you need per 1,000 population. So, for instance, for the World Health Organization, they tell you straight, per 1,000 people, you need a minimum of one doctor for you to be able to render a safe, effective service. In South Africa, we're only sitting at 0.3. So that's our first issue, the fact that we don't even have a structure or organograms of these hospitals that speak to what these hospitals should have in terms of population. So that's one of the issues. The other is obviously the gross underfunding of health. Health is not funded appropriately. I think it's because of various reasons. We are seeing a lot of patients, more than is on paper in terms of organogram. We do have cross-border issues where we are getting more, migrants and things moving around. So that affects budgeting of hospitals. And also, in general, the South African economy is a problem where even money for goods and services, it's at a point where you can't even afford to buy the basics. So all of that has snowballed now into the part where we don't have money, and it's gotten so bad that once a person leaves, that money sort of disappears back into the system. And we are trying to work with what we have. And let's forget about also looking into the future about creating specialists. Those specialist posts as well have not been advertised in a while. You'll be surprised to find one or two, which you'd understand how dangerous that is for a country. That could mean now, as a province, we would no longer be able to perform certain things like urology or pediatric surgery. We'd have to send it out of the province because it takes about 4 or 5 years to produce that specialist. So it's been a snowball effect of mismanagement of money, of Treasury underfunding us, and of us not accepting that we need staffing norms so that we understand what is our baseline.
I know the focus is on KZN right now, but just nationally, how widespread is this problem, the issue of unemployed doctors and understaffed hospitals?
It is a big national problem. Like, for instance, like you're highlighting in KZN, the doctors were there previously, and we intervened at summer. We organized a meeting with the prime the Premier. He did promise to get back to us at the end of the month. So we are looking forward to that report back. At that meeting, the 20 posts you talked about were already then agreed on and have been advertised. But we're needing around 300. So we did say that is a drop in the ocean. They are gone. They went back to the streets on the 6th because I think they wanted to give them time to respond and they didn't. In other provinces, it's also taking shape. We've had protests and
mm,
it's coming in different ways, like in Limpopo, where they tried to implement the call shift system. That was another way of trying to do the exact same thing. We then had Gauteng try and cut off COT, which we took them to court for, which is the commuted overtime. And we now have another province, Northwest, that is trying the same thing. So we are going to court to deal with them cutting off COT. So they are doing it in different shapes and sizes and trying to cut out money, making it look like the expenditures on doctors, when at the end of the day, one, you are underfunded. Two, you are grossly mismanaging your money, and the management infrastructure in itself is bloated. We need to look at it holistically.
mm, mm. And one thing I want to focus on is we know the consequences on South Africans is quite obvious. There's long lines in our hospitals. There's some surgeries that can't be performed, and ultimately people lose their lives. I think we know and understand that aspect, but on the unemployed doctors themselves, I'm sure you deal with a lot of them. You support them quite passionately and closely. Just talking to them, being unemployed when you were told you have one of the most desired degrees in the world, but you can't find work. I'm sure that must be difficult.
It's beyond difficult. It's disheartening. Can you imagine being a qualified, a medical professional? Your family had put all the hopes and dreams into you, and here you are, and after internship you've got nothing to show for it. Some people, they've even bought properties or cars, things like that, and unfortunately some of them have lost them because they cannot gain any employment after internship, which is unfortunately mandatory. Now, the other problem that you've got is that even if they try and find work within the private sector, this is another area that as summer we've been trying to intervene on. The private sector expects you to have like your ATLS, your PELS. These are short courses for you to be able to work in the casualties. Just to register for ATLS alone is 9,000.
Wow.
Where are you expecting an unemployed doctor to get 9,000 just to get that short certificate? So we are working to see what we can do. We've discussed with hospital groups. We are trying to see if we can co-fund for these doctors so that they at least do have something that will give them a stable income. A lot of them are also doing locums with other doctors, but that's not stable. It's when the doctor has a space. So it really is disheartening. They are really, in desperate situations where they've lost cars, lost money. Others have kids, and now, it becomes an issue because what happens? And your family, was looking up to you. So it's a very, very dire situation that we are in right now.
Mm, mm, mm. And just long term, I'm thinking about other African countries where ultimately there was a lot of brain drain. Most of their doctors even found themselves in the South African healthcare system. And well, their countries are left in destitute when it comes to healthcare. They don't have enough doctors. Possibly in the near future, could we see a same situation, same scenario unfold here in South Africa? People are looking for opportunities, and countries like Australia, the UK, even Saudi Arabia are open for South African doctors. Are we likely to see a brain drain kind of scenario unfold where we ultimately don't even have doctors at all to serve the public healthcare system in particular?
Yeah, unfortunately, you are going to see a brain drain. We're already seeing it.
Mm,
Initially, it used to be our elite. the cream
Mm,
of the crop, our specialists, because those hospitals wanted to decorate themselves with well-trained, seasoned people. We're now at a point where our junior doctors, and by the way, South Africa has some of the best when it comes to practical, because we are on the ground. Our medicine is clinical. We don't rely on, technology for diagnosis. So we are very well known for that. So when these countries are looking for people that they can put, especially in far-flung areas, they make it very attractive for the
mm,
doctors to go there. So it's definitely happening. And unfortunately, the younger group are not yet established, where they've got too much to think about in terms of family and school and roots. So there is an attraction for them to go out there, because what is the alternative if their own country cannot give them employment? So they are, and I do know that a lot of the countries are also working around the requirements for them to be able to be registered to practice in those countries, which is making it even more easier for them to go there. Now, as South Africa, we definitely don't want that. We believe that we've invested in these cadres. Even if they don't have a bursary, South Africans must know that they subsidize medical schools. So these
mm,
are our products that we're wanting to see serve the South African population. And a lot of them, we did an interview in KZN. We got more than 1,800 doctors responding, saying yes, they would love to be able to work and serve in public service. Unlike what we're hearing, where we're told doctors don't want rural and all of that. But it's becoming virtually impossible, and they do need to make a living income. So we are trying to push to make it possible and to make it more favorable for these doctors to stay here in this country.
No, most definitely, and I like the point that you're making that they want to serve here in South Africa. I mean, we even saw yesterday when they were protesting in Pietermaritzburg, there were even makeshift like tents outside for them to like kind of work to show that they want to serve the country. Just lastly, before I let you go, Doc, as Sama, what are you calling for right now? What would you like to see the government doing? Is it a reallocation of funds? Tapping into the national 2.8 billion fund, I think that is there. Is it accountability of some sort? Ultimately, what is the end goal? What are you calling for?
The end goal, I think, let's start with the fact that what Dr. Mutsaledi promised 1,200 posts. Yes, we know that these are not all doctors' posts, but they're clinical posts. We want to see them on the ground. The closest province that has come to actually operationalizing the promise of the post is Gauteng. We want
Mm,
to see those 1,200 posts on the ground. Then, secondly, we want a national dialogue between Treasury and the Department of Health about funding for the Department of Health. We know exactly how many doctors we are producing every year, because medical schools only take so many, because it's a clinical discipline, it's bedside. So we know exactly how many in a year we are producing and how many we should be budgeting for. So Treasury and DOH need to get to a point where this does not become a surprise every year, where it's like we didn't know. So they
mm,
really do need to look at that. And then in terms of infrastructure, I personally feel that we should be fixing the infrastructure that we have. Yes, well and good, we do need new things, but can we make sure that what we do have is workable and it's also keeping up to date with what the technology is? And then I think also overall governance accountability needs to be put in place, because some of these places, when you actually get to the root cause, it becomes a governance issue of why things were being run down and things. I know we all like to cry about corruption and things, but sometimes it's just managers not doing their
mm,
job, and those must be held accountable. I think those things need to happen. And for me, one of my passions is for us as South Africans to one day realize that health is a constitutional right.
mm,
It is not a budget item. It is not a luxury. It's a constitutional right like water. And until we get that to come through in the way that budget and treasury speak, we'll constantly have a problem within South Africa. And I'm hoping that in these conversations, we're going to bring public sector on board, because I still see how when we are discussing health, there's always a separation between us and public sector, but yet we're saying we're going to the NHI. If we could really make sure that the minister brings them together, the amount of resources and the amount of possibilities would be crazy. In South Coast, you've got Port Shepstone Hospital here. Next door, there's Hibiscus Hospital. They cannot do dialysis here, but next door you've got a hospital that has 10 dialysis beds where they could take, which is ridiculous.
Mm.
So we honestly need to take this thing of public-public partnership seriously as well. But I really think that serious talks about treasury and funding and all these posts that have been promised need to happen.
No, most definitely. Dr. Zanele Bikitsha, thank you so much for that very insightful conversation. Really appreciate your time.
Thank you very much.
There you go. That was SAMA President, South African Medical Association President Zanele Bikitsha. I think painting quite a grim picture when it comes to the state of our healthcare here in South Africa. I mean, what is a country that can't even hire doctors? Okay, can't hire doctors, can't hire policemen, can't hire teachers. It feels and looks like every aspect of public services is falling apart. What do you even tell kids? What do you tell them to study when they can graduate 7, 8 years, worked very hard? And as people of color, we know the kind of resources, the kind of hope, and sometimes burden that is put onto an individual who goes out to study at an institution of higher learning. And you come back with your qualification, but you can't find a job. Is it time to finally accept that things are really bad in the country and we need to do something about it? Okay, potholes, that's fine, man. It's minuscule. Can get sorted out. Can fix traffic light. But you can't hire doctors. Going to take a quick break. When we come back, News and Views continues after this.